Good morning all. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please subscribe to my channel and also please give your valuable comments. In the last class, since last few classes, we are discussing about interpretation of the CBC, and in this regard we have already seen 3 or 4 cases of different CBC interpretation, and we are seeing that how simply interpreting the CBC is helpful for the diagnosis. We have seen the case of iron deficiency anemia, we have seen the case of megaloblastic anemia, we have seen a case of normochromic normocytic anemia last time, and such a way we have seen a case of thalassemia. So different cases we have seen. So today we will have another important case regarding same, how CBC can help us to identify the disease. So this is the case. This is 1-year-old child with a history of sudden pallor and puffiness since 1 day. Now what has to be observed is 1-year-old child, history of sudden pallor. Pallor was not slowly progressive or pallor was not present previously. Now, sudden onset of pallor, maybe about 10 days or 12 days, the pallor gradually developed. Before that, there is no pallor at all. And along with that, there is also puffiness of the face. Now, puffiness of the face is since last 1 day. And they are telling that even pallor is also observed since last 1 day. That means very rapid onset of pallor. Okay, this is one point. 1-year-old child, okay. And jaundice and dark urine is there. Child is also having jaundice and child is also passing the dark urine. That means deeply colored urine. That means a lot of conjugation has been taken place. So because of conjugation, urobilinogen comes and the urine color becomes more and more deeper or darker. So something is causing some conjugated jaundice also maybe. Okay, and fever and cough since the last 7 days. There is also fever and cough since last 7 days. This is the history. That means we have to take like this. Child is already having fever and cough since last 7 days. But since last 1 day, child suddenly developed a pallor and as well as puffiness of the face. And child is also having jaundice with the dark urine. Now on examination, if you see the pallor is plus, icterus is also present, puffiness of the face is also present, and child is breathless. Now this is another important thing. Child is breathless and the spleen is 3 cm palpable. So child is also having some breathing problem now. And if you look into that, spleen is also 3 cm palpable. That means tip of the spleen is sometimes palpable normally in the newborn baby. But this is 1-year-old baby. 3 cm spleen palpable means it is of course some pathology, no doubt. Yes, now by looking at this particular case, what assumption you can get? Any idea? Yes, can you repeat it?
Hemolytic.
Yeah, definitely this is hemolytic anemia. Because why it is hemolytic?
एक सडन पलर है ना, और स्प्लीन भी palpable और एग्जामिनेशन मतलब यूरिन भी डार्क कलर आ रहा है, आरबीसी वो हो रही है, डिस्ट्रॉय हो रही है.
Yes. Sudden onset of the pallor may not be seen in case of congenital hemolytic problems because they are slow in onset. Deficiency anemia ऐसा कुछ है तो वहाँ पे भी slow onset में आ जाएगा. But here within 1 day, sudden appearance of the pallor means suddenly the RBCs are unexpectedly get destroyed. Such a sudden destruction of the RBCs can occur only in case of autoimmune disorders. Some of the autoimmune disorders related to hemopoietic system or hematemic system. So now that's the one point. Then more and more RBCs are destroyed, therefore more and more unconjugated is coming to the liver and it has been conjugated, and as a result conjugated bilirubin is formed more and more than the normal, 6 to 7 times more than the normal, and as a result the urine become dark. That is also obvious. But very important you have to understand is fever and cough history is there. Now we know that any of the autoimmune disorders usually they are preceded by the fever. There will be a history of fever few days back, 1 week back or 15 days back. Okay, and because of that viral fever, maybe that viral fever, so that will overstimulate the body immune system, or your body immune system gives an exaggerated reaction to that particular fever, and as a result there is chance of formation of some of the autoantibodies against that particular RBC or any other body cells. Okay, so one thing is very clear, this fever is causing this particular autoimmune problem. No. Yeah, okay. Then breathlessness may be because rapidly the RBCs are get destroyed, and as a result there is hypoxia, and this may lead to the breathlessness. Spleen is palpable, so spleen is working more. That suggests that spleen is working more because it has to clear the destroyed RBCs. So it has to it is clearing more and more RBCs. Therefore, spleen is also working more. Therefore, spleen size is also increased. So in total, this looks like a case of autoimmune pathology, which is triggered by an upper respiratory tract infection like cough and cold, maybe a viral fever. Come to the next point, which is very important for us. And if you look into this particular CBC, see, investigation suggests that HB is 6.5, it's not centimeter. Okay, so 6.5 mm Hg. Then, HB is 6.5 grams. Okay, so MCH is 100. Again, there is a spelling mistake. It's not MCH. It is MCV, means corpuscle volume. MCV is 100. MCH is 28. And MCHC is 80. WBC 18,000. Polymorphous 70. Lymphocytes 30. Platelets 2.5 lakhs. Bilirubin total 4.3. Direct is only 0.5. And reticulocyte count is 8%. Reticulocyte 2% is normal. Now it's 8%. So when reticulocyte count is more, what it suggests? More and more RBCs are formed. Why more and more RBCs are formed than the normal? Because there is rapid destruction of the RBCs. Therefore, there is a need of RBCs. Therefore, bone marrow is doing the work more. Therefore, more and more immature RBCs are coming into the circulation in the form of reticulocytes. So when reticulocyte count is more, always we have previously also seen it is indicative of a hemolytic pathology. So okay, now comment on this particular. HB is 6.5, MCV is 100. So what it suggests? MCV 100, normally it is 90, so borderline increase is there. That means there is more and more production of the RBCs going on because of some rapid pathology. बहुत ज़्यादा RBC destroy हो रहा है, तो ज़रूरत है बॉडी के लिए RBC का, इसलिए ज़्यादा से ज़्यादा RBC का प्रोडक्शन बोन मैरो से चल रहा है. तो इन द प्रोसेस कुछ इमेच्योर RBCs भी आ रहा है, मे बी मैक्रोसाइट्स भी आ रहा है. सो इसलिए थोड़ा बहुत जो है MCH बढ़ा हुआ है. दिस इज क्वाइट नॉर्मल. इफ यू सी MCV बढ़ा हुआ है. MCH hemoglobin percentage is 28. It's okay. Normal it is 30. It is 28. Not bad. MCHC is normally 33%. I think there is a mistake here. Okay. So this value does not holds good here. Maybe MCHC 80%. Is it possible? It's doubtful. We will have a doubt on that. Okay, now WBC is 18,000. MCH is normal. How much? Hemoglobinization 33%. So it is showing 80. We will see. अगर आगे कुछ है तो इसके बारे में पता चलेगा. So WBC is 18,000. So now MCV, MCH and MCHC. By looking that everything is everything is under normal limits, isn't it? Even RBC count is 6.5. That is because of the hemolytic pathology which is going on. Therefore, RBC count is 6.5. Okay, that means HB is a 6.5. HB is 6 because hemolysis is going on. And WBC is 18,000 and polymorphous 70 and lymphocytes 30. Platelets are 2.5 lakhs. Reticulocytes 8%. Reticulocyte 8%, okay, justified. Bilirubin total 4.3. Yes, jaundice is there, dark urine is there, everything is there. Okay. Platelets 2.5, reduced to half almost all. Some activity of the platelet is also decreased. Now, let us look into the case properly. Analysis, if you see, when the child is having the jaundice, just ask the color. Okay, is it haldi like, turmeric like, or cola color? Okay, so Pandu, Haridra, Haritan. Ayurveda very clearly says 3 types of color: Pandu, Haridra, Haritan. Okay, Pandu Varna, Haridra Varna, and Harita Varna. Pandu Varna, Haridra Varna, and Harita Varna. So now, just ask the question: haldi color, or turmeric color, or cola color. And if the patient is telling that it is haldi color, usually it is a direct bilirubin due to liver issues. And if it is cola color, it is definitely due to hemolysis. This is how you have to understand. Hemolysis हो रहा है तो हमेशा जो है बहुत डार्क कलर एकदम कोला कलर आ जाएगा यूरिन. Okay, and simply because of some of the liver issues, then you will have the Haridra color. Now, child is having the history. In this case, the dark urine is there, cola color urine is there. That means more and more RBCs are destroyed. So when the more RBCs are destroyed, more iron metabolism takes place, more biliverdin is formed, and more bilirubin is formed. Okay, that issue is clear now. Child is also having dark urine. So almost all dark urine means cola color. You can, if you want to see that color, see this is a color. See, in this patient, this is a normal color if you see, but this is a cola color. See, very dark color it is. Okay, so this suggests hemolysis always. Now, child is having the history of a fever and also cough since last 7 days. So this is already I have described. So some upper respiratory viral infection is taking place, which had have been precipitated this event of hemolysis. ठीक है, ये जो ऑटो इम्यून hemolysis का जो पैथोलॉजी है, इसको जो ट्रिगर कौन किया, जो एक respiratory tract infection हुआ है, because always respiratory tract infection history has to be asked. Okay, so patient may give the history of upper respiratory tract infection or viral infections 10 days back, 7 days back, or 15 days back. So this history is always very important too. Suppose if the child is having appearance of such sudden symptoms after an attack of these viral infections, then always we have to think about autoimmune pathologies. We know the same thing is happening in case of Guillain-Barré syndrome also, isn't it? GB syndrome also. So there is sudden loss of the motor weakness. There is sudden motor weakness which is developing with the loss of reflex and all those things. But if you ask the history 2 weeks back or 10 days back or 15 days back, they will give a history of a upper respiratory infection. So what it suggests, that particular viral infection has been precipitated this autoimmune pathology. So here also we are getting a very clear-cut history of a upper respiratory infection. Now there is sudden splenomegaly also in this case, isn't it? So when there is a sudden splenomegaly, again it indicates that some rapid destruction of the RBC is going on. So there is also sudden breathlessness. Sudden breathlessness is also that is because the anemia which is very rapidly developed unexpectedly, and also because of anemia there is puffiness of the face also. So almost all the symptoms are justified now. Now the rapid onset of pain is rapid onset. So that again suggests the autoimmune pathology. So see, pallor is not a symptom which has to be developed very rapidly, isn't it? Usually it is a symptom which usually gradually develops. Okay, so edema sometimes may develop very rapidly. That's a different issue. But pallor and such symptoms, they usually develop very slowly. But it is rapidly developing. So pallor rapidly developing, either there should be hemorrhage or there should be hemolysis, isn't it? Sometime in intraventricular hemorrhage, in the newborn baby, intraventricular hemorrhage, child is having intraventricular hemorrhage from the uterine period itself. At the time of the birth, child is nil, asphyxiated, and child is not crying at all. But if the child, instead of looking cyanosed, if the child is looking paler at the time of the birth, when you are receiving the baby is not crying, totally nil, but instead of looking cyanosed, the child is showing paler, suddenly paler. So that usually suggests towards intraventricular hemorrhages. Okay, the cause of the problem of the child which is not crying, the cause may be because of intraventricular hemorrhage. So even the hemorrhage may also sometimes lead to, sudden hemorrhage may also lead to pallor. Otherwise, the second important cause is sudden hemolysis. Okay, so this is a case of autoimmune pathology, no doubt. Now, let us see. But if you look into the CBC of this child, if you look into the CBC, HB is 6.5. Okay, MCV is 100, mean corpuscle volume, a little high. Okay, it should be 90. WBC is normal, and platelet count is a little low, but can consider as normal, no problem. Bilirubin, indirect bilirubin is increasing. See, increased total bilirubin. See, direct is, they are telling direct is only 0.5, and total is 4 point. So if you detect 0.5, so 3.5 is indirect bilirubin. So indirect bilirubin suggests that over hemolysis, more and more RBCs are destroyed, more and more bilirubin, biliverdin is formed, and it is coming to the liver for the conjugation. So that leads to increased indirect bilirubin. So everything is almost all matching. Okay. So when we say MCV is high, okay. So here MCV, if you see, it's 100 instead of 90, it's 100. So if you consider it as high, so when MCV is a high, in the chart I have given, table I have given, whenever the MCV is high, always think about megaloblastic anemia, isn't it? Of course, it occupies more space. So MCV is high. So megaloblastic anemia. But there are some other important causes of increased MCV. ठीक है, MCV जो है कोई डाउट नहीं है मेगलोब्लास्टिक एनीमिया में बढ़ता है, बट MCV बढ़ने का कुछ और कॉज भी है. So one of them is acute conditions. Any of the acute conditions also, like this condition, acute development of autoimmune pathologies leading to destruction of the RBCs. Okay, any acute condition with anemia and jaundice that may also lead to MCV. This we have to keep in mind. Otherwise, MCV increases in case of RDW will also increase and MCV will also increase. That is typical case of megaloblastic anemia. But some of the stressful conditions or acute conditions like this autoimmune disorder or autoimmune hemolytic anemia also MCV will be high. Therefore, MCV is little high here. Little high here. If you see further, in the slides, we can see as this is one of the autoimmune pathology. Autoimmune pathology means some of the antibodies are produced from the body immune system. They are going and attacking the RBCs and destroying the RBCs. So as this is autoimmune pathology, when you are preparing the slide, you can see some of the clumping or what you say agglutination, because वहाँ पे जो destroy कर रहे हैं ना तो agglutination मिल सकता है. Because of this clumping, as the RBC can be calculated properly, the MCHC values are given high. Yes. अब हमें आंसर मिला जो MCHC का जो वैल्यू 80 क्यों आए यहाँ पे, है ना, हम डिस्कशन कर रहे थे. जो MCHC का ये जो वैल्यू है that is 80 आ गया, 33% होना चाहिए, but instead of that 80 है. Now we got the answer for that. This is a autoimmune pathology. Because of this autoimmune pathology, the RBCs are getting destroyed. Their clumps, माने agglutination हो गया, ठीक है, वो जाके उसको nullify कर दिया उसको RBC को, तो clumping हो गया पूरा. Because of this clumping, actual amount of the RBC which has to be calculated is not able to calculate. ठीक है, तो इसलिए जो है MCH का वैल्यू जो है वो हाई आ गया. हीमोग्लोबिनाइजेशन, अमाउंट ऑफ द हीमोग्लोबिनाइजेशन वो हाई आ गया, क्योंकि आरबीसी को ही हम ठीक से काउंट नहीं कर पाए यहाँ पे, और आरबीसी जो था वो भी जो है क्लम्पिंग हो गया, उसके अंदर कितना हीमोग्लोबिन है वो सब हम देख नहीं पाए. देयरफॉर वैल्यूज आर गिवन हाई. ओके, सो व्हेन वी से MCHC इज हाई, ऑलवेज थिंक ऑफ इम्यून हीमोलाइटिक एनीमिया. दिस इज अनदर इंपॉर्टेंट क्लू. सो MCHC यूजुअली हाई नहीं होता है, ठीक है, हीमोग्लोबिनाइजेशन इतना ज़्यादा हाई नहीं होता है, बट इट इज़ हाई. Usually it is high in case of immune hemolytic anemias, because actually we are not able to estimate the exact amount of the hemoglobin present there because of the clumping. Therefore the values are given high. Very important take home message. So whenever MCHC is very high, always think about immune hemolytic anemias. Whenever MCV is high, always think about megaloblastic anemia. megaloblastic anemia, or MCV is also high in some of the acute conditions. Okay, in the acute conditions like autoimmune disorders. So this is the important message. But what actually happened in this case, in the urine, blood is positive. ओके, दिस इन्वेस्टिगेशन हमने शुरू में नहीं दिया था, बाद में हमने जो किया था इन्वेस्टिगेशन, उसमें जो है यूरिन में जो है ब्लड पॉजिटिव है. डायरेक्ट कूम टेस्ट इज ऑल्सो पॉजिटिव, DCT डायरेक्ट कूम टेस्ट भी पॉजिटिव है. एंड वी फाउंड IgM ऑटो एंटीबॉडी. IgM ऑटो एंटीबॉडीज 1:128. और दूसरा जब कल्चर किया तो माइकोप्लाज्मा AB इज ऑल्सो पॉजिटिव. ये लेटर इन्वेस्टिगेशन किया, CBC के साथ इसका कुछ लेना देना नहीं है. जस्ट फॉर द कंफर्मेशन ऑफ द डिसीज, एग्जैक्ट डायग्नोसिस ऑफ द डिसीज, वी हैव गॉन फॉर दी. एक बार हमें इतना पता चल गया कि ऑटो इम्यून डिसऑर्डर है. अब ऑटो इम्यून डिसऑर्डर है तो हमें ये देखना पड़ेगा, DCT डायरेक्ट कुम टेस्ट करना पड़ेगा. ठीक है, IgM कौन सा ऑटो एंटीबॉडी है उसको पकड़ना पड़ेगा. सो वी वर्कड फॉर ऑल दैट थिंग्स. सो देन वी गॉट दिस मैसेज. सो नाउ दिस इज एक्चुअली mycoplasma AB is positive. So this is autoimmune hemolytic anemia following ना mycoplasma infection. जो फीवर वगैरह जो आया था तो वहाँ पे वो mycoplasma infection था. Usually in case of mycoplasma infections, of course यहाँ पे mycoplasma, it may be any of the viral infections से भी हो सकता है. It can occur because of any of the viral infections. So usually in children, they usually recover by themselves. So this failure will be there for 10-15 days. Okay, acute failure, then the disease process comes down, amount of the auto antibodies comes down in the body, then again the RBC level count. So maybe usually recover by themselves. Okay, so sometime you may require the steroids, because sometime it may be biphasic. कभी कभी steroid का भी जरूरत पड़ सकता है. That's a different issue. Now this is how a simple CBC will going to help, and there should be the approach. We are not discussing any of the Ayurvedic aspects here, because this is totally a blood investigation class. Therefore, okay, Pandu, Haridra, Haritan. Okay, in case of Pandu, we have got different issues like Ladraka is there, Panaki is there, so then Halimaka is there. So we have to consider all these aspects here, Halimaka, Ladraka, etc. Okay, so usually हम जो पांडु है वहीं पर restrict हो जाते हैं. It's not like that. It's very clearly mentioned. अंतर लाड्रका में, पानक में बहुत सारे important symptoms दिया है. That are the chronic stages. Okay, so Pandu, Haridra, Haritan. So if you see different types of Pandu, Vata, Pitta, Kapha, Pandu, and then we have got different other Kamala types. Then we have got Ladraka, Panak, etc. If you look into the symptoms carefully, definitely you find one of them as autoimmune pathology. जो ऑटोइम्यून हीमोलाइटिक एनीमिया जो की वजह से जो पांडु आता है, डेफिनेटली एक वहाँ पे आपको मिल जाएगा. सो दिस इज ऑल अबाउट केस नंबर 5, एंड दिस इज सम ऑफ द पिक्चर्स ऑफ दैट पर्टिकुलर पेशेंट. दिस इज बाइट सेल्स. नाउ we look into another important case. So with this we complete the case number 5. Now we will look into case number 6.